Hello viewers, I come your way again with another video, and this time I'm talking about cervical cancer. So this month is cervical cancer awareness month, so I'm sure you've heard a lot of information on cervical cancer. I just want to add this to whatever you may have heard. So cervical cancer is only in women and in females, so this is not a type that can also affect males because males do not have a cervix. So when we talk of the cervix, is the entrance to the womb. So that's the cervix. And so cervical cancer is a type of cancer that affects the cervix of a woman. Now, in terms of some figures about cervical cancer, when it comes to sub-Saharan Africa, of which Ghana is part of, it is the second most diagnosed cancer in women and the second leading cause of death, cancer-related death in the country. I think there was a figure of over 2,000 women dying of cervical cancer in 2019. So it's something that is quite alarming. And the whole reason is that most of the times the diagnosis is made late because people don't come to the hospital in time for early diagnosis, because when it's diagnosed early, it can easily be treated. It can be cured actually. So the early diagnosis is very important. Now there's one major risk factor that is associated with cervical cancer, and that's infection with HPV. HPV is human papilloma virus. So this is a sexually transmitted virus. So it's passed on through sex. So the man can carry it but may not have any health issues. But when it gets into the woman, it causes changes around the cervix of the woman. So these changes, sometimes the body is able to deal with the infection and clears it, but other times the infection persists. So when it persists for a long time, it begins to cause changes in the cervix, which in the long run can result in cancer. This can last for a duration of over 10 years before you start seeing visible changes in the cervix. So it means that the virus can stay in the cells of the cervix for a very long time. That is why when screening is done and the virus is picked up, it can easily be treated, and then it will not eventually lead to you developing cervical cancer. So now the emphasis is on screening. Screening is very, very important. Now there's a vaccine that helps with the prevention, but the vaccine, per the recommendation, it's usually when you are in your teens, in the teenagers. In the teenagers, it's very much recommended. So you have to take about 2 to 3 doses of the vaccine, which is very uncommon. In Ghana, we do not have a national program for the vaccination of cervical cancer. Talks are ongoing to get it incorporated into the immunization calendar for the country. But for now, it's usually groups that are organizing free screenings and then vaccinations for people, because the vaccine is quite expensive. So it's not in the government system yet. But the key is that screening is very important, and the screening tests are not so expensive. So the screening tests, we have one that is just visual inspection with a chemical acetic acid. So that is done, and then if there are any changes in the cervix, it can easily be seen. The gold standard for the screening is pap smear. I'm sure most of you may have heard pap smear. So if the pap smear is done and any abnormal changes in the cervix is picked up, it can be treated. There are various forms of treatment if changes are picked up upon the screening. So it's very important that we take the screening exercise very seriously. After screening, I would advocate for immunization. Though it's expensive, it's better to bear the cost for not getting cancer in the long run than to based on the cost and not get the vaccine. So for teenagers, it's very much recommended. Even now, for adults, it's been accepted that vaccination helps after screening and knowing that nothing is there. So those are the things that we have to take note of. So in terms of the risk factors, having multiple sexual partners is a major risk factor, and early age of first sex is also a major risk factor. And for people who have delivered a lot of children, it's assumed that the more children you have delivered means that you've had a lot of sex experience. So that's just the relation. Some people who are taking contraceptives for a long time are also noted to have a minimal risk, but that is not due to the fact that you are taking the contraceptives. Sometimes, based on the contraceptives, people engage in lifestyles that they think the contraceptives will not make them pregnant, not knowing that the contraceptives, if you are not using barrier method or condoms, it doesn't protect you from sexually transmitted infections. So that's something that we have to take note of. So cervical cancer is common. It's very common in Ghana, and it's killing people. And the truth is that if, like as I said earlier, the organism can stay for over 10 years before it starts manifesting changes in the cervix. So if screening is done regularly, so the recommendation is that you screen every 3 years. Before age 30, screening is every 3 years, and then after age 30, screening is every 5 years. If this screening is done, it means that it can be picked up early in time and then treated, so that you don't get the cancerous changes in the long run. So it's very important. Cervical cancer is very important. Now, if you are screened and then the virus is picked up, it's very important that your sexual partner is also treated, because they will carry it. The males will carry it and will not show, it may not have any effect on them, but whenever they meet with you, they have sex with you, they end up transferring it to you. And the means of transfer is contact, skin to skin contact. Sometimes the males can carry it in their semen. So when the semen gets into you, they colonize the cervix, and then they start causing changes after inhabiting there for a long time. All right, so let's get interactive. Ask your questions. I'll be glad to answer them, so that at least you get to know as much as possible concerning cervical cancer, as we've spoken about. Try to subscribe to the channel, share the video, like it, call others to get involved, and let's grow together. Thank you.